Some people ask me what is a dental implant. Dental implant is basically a root form that is made out of titanium. And basically when the tooth is removed, it's replaced by the titanium screw that is taking the place of where the root used to be. So that's what a dental implant is. Another way to think about implants is like trying to anchor something on a drywall. If there's already a pre-existing hole, you would use a bigger screw to create an anchor when you're screwing it into the hole. So the same as implants on a jaw. If we're extracting the tooth, there's already a hole that when the tooth comes out of the bone, there's already a hole there. We can use a bigger implant so as to fasten it onto the bone and then wait for it to heal. So we can use that as an anchor for a crown. So let me explain how this works. Just imagine that if this is the tooth that needs to come out, so we extract the tooth. So now there is a hole in the bone that is occupied by this tooth. So what we do with the implant is basically it is a titanium screw and it goes in. We just place them in, screw them in like what I'm doing right now until it's completely in the bone. Then during the 2 to 3 months of healing, the bone will grow into the groove of the implant and it will stabilize, and that's when we can anchor the implant. We do that by placing what we call an abutment, which is on top of the implant, and thereby replacing that tooth. And we can just place a crown on top of the implant and cement it. So that's how the implant works. Here are some things that we need to keep in mind if you're interested in dental implants. And it pertains to the medical history. So the 2 things that I look for are diabetes and smoking. So for diabetic patient, if they are uncontrolled diabetic, it is harder for them to heal and thereby having more implant failure. For smokers, the same things applies. When they smoke, it is harder for them to heal and thereby having higher failure rates too.